Hi, I'm Dr. Susheel Bindroo. I'm the Director of Department of Interventional Pulmonology at Sir H.N. Reliance Foundation Hospital, Mumbai. So as we all know that 24th of March is celebrated as World Tuberculosis Day. I don't know whether it is celebrated or it is regarded as a Tuberculosis Day because it is not a celebration. As we all know that tuberculosis is once again now one of the most fatal infections, and it is there since time immortal. So the WHO and the other governments of all the countries, especially the developing countries like India, Sub-Saharan Africa, the Asian countries, they are working in sync towards elimination of the tuberculosis. So one of the main motives of the present government is to eliminate tuberculosis from India by 2025 under the I Defeat project. So tuberculosis as a disease is debilitating, is highly infectious. It mainly affects the productive lives of people. That means when in young to middle-aged people, when they should be earning for the country, for their family, but they become sick. A dreaded form of tuberculosis is the multi-drug resistant tuberculosis, which if not treated properly can lead to death of the patient. And as I told you that because of the highly infectious nature of the disease, if a person gets tuberculosis, he is highly likely to infect people around them if the proper cough etiquettes or the respiratory etiquettes are not taken into consideration, like wearing a mask, maintaining isolation, covering the nose and the mouth during coughing. So these are the things which can prevent the dissemination of the bacillus and spread of the disease. The one thing which I this time felt good for the first time from a government decision, that treatment for MDR tuberculosis will be now done by the government hospitals and the private hospitals, which will be earmarked by the government, because the newer drugs for the MDR tuberculosis, which have been shown to markedly reduce the duration of treatment for these patients, they will be available only at these specified organizations. Now, once we stop the over-the-counter sale of these drugs, then the chances of developing resistance to these drugs will be decreased. So this is a very welcome decision of the government, which will definitely help in decreasing the incidence and prevalence of multi-drug resistant TB. And per se, the TB has to be eliminated, because as I told you that it decreases the productive life of people and leads to death of younger patients, and which leads to increase in number of orphans, widows in the society, and it decreases the GDP of the country, and also leads to increased poverty. So it becomes a vicious cycle. Poor people develop tuberculosis, then they become, they are not able to work, and then they become poor again. So we need to take a resolve on this World TB Day, that we as public, we as doctors should take all the steps to decrease the transmission of the disease, and as doctors we should properly identify these patients, properly diagnose the disease and give them proper treatment in normal dosage and for normal duration of time. So that is my message for World TB Day.